So what are the primary things that go wrong with children? Like how they get injured? Toddlers.
Getting in poisoning and stuff.
Yeah,
like that.
poisoning because they put everything in their mouth, right? Poisoning. And I know that it did talk about, they put objects in their mouth, so poisoning, choking, and they can get like hurt because they fall off things like bicycles or playground equipment. So if an infant gets poisoned, what do you do? Do you take them to the ER?
You call
poison control.
Call poison control. Do you make them throw up?
Call poison
Call poison control. Do you give them syrup of Epicac?
Call poison
Call poison control. That's always the answer.
So
Call poison
call before
control.
you do anything.
Yeah.
Okay.
So they'll
Yeah.
tell you if it's like what they need to do
Yeah.
or if
Even
need
if
to
you
go
have
in.
someone that comes into the ER and it's suspected poisoning, the ER calls poison control.
Okay, that's what I was gonna
Yeah.
ask.
So you call poison control.
Child's with poisoners when she was little.
I did that when I was a baby, but I don't remember.
You just hear about it all the time.
Yes, the famous family
Yep.
evening story.
Okay. So what is the biggest issue with the elderly, and especially in the hospital?
Falls.
Falls. And it talks about fall and pressure sores too. But it talks about falls on page 367 and 369, and I would look at both of those paragraphs. So there are things that can increase someone's risk, like being over age 65, poor vision, orthostatic hypotension, kind of interesting, so we might want to make sure to dangle people on the side of the bed, icy sidewalks, throw rugs in the home. It's all really straightforward, but we need to make sure we get them eye exams, we decrease hazards in the home, provide adequate lighting to prevent falls. We always want to prevent falls. So make sure you're assessing people's gait properly. Falls can extend a patient's length of stay, and then they could get pneumonia or something even worse. So we don't want people to fall. That's bad. God, there's a lot of stuff about falls in here.
Insurance companies won't pay for them either.
Yeah, that's true. They're considered a
Never.
it
Never
just-
event.
Yes, thank you. An incident report, never event. 384. Why did I have 384 written down here? Oh, this talks about like fall prevention protocol. Make sure people are using their assistive devices. Like if they need a cane, they're using their cane. If they need a walker, they're using their walker. That kind of thing. So that's pretty much it. And we use gait belts when we ambulate patients, but that's really straightforward. You guys are probably pros on how to prevent falls now. Fall precautions. We already just talked about falls. Who's at risk? Elderly. And people on medications. So I don't know if you guys have talked about morphine yet or things like that, but how sometimes sedation can put someone at risk. What other medication can you think that would require a patient getting up all the time to go to the bathroom? Diuretics. People on Lasix or other types of diuretics are at a very increased risk for falling. So just be aware of all those other things that